Hello beautiful people, welcome back to my channel once again with another new topic, that is biochemistry MCQs part 7 question, that is the continuation of part 6. The topics included in this are vitamins and tumor markers. So before starting the video, I would like to request you to please like, share and subscribe to my channel. Keep supporting me and let's get started with our today's video. So today our first question is, scurvy is associated with deficiency of which of the following vitamins? Option A, vitamin A. Option B, vitamin C. Option C, niacin. Option D, thiamine. So scurvy, the word scurvy is associated, that is a disease which is associated with the deficiency of which of the following vitamins? So the right answer is option B, because of the lack of vitamin C, they may cause scurvy. Next, moving on to our next question. Rickets is associated with deficiency of which of the following vitamins? Option A, vitamin B1. Option B, vitamin C. Option C, niacin. And option D, vitamin D. So the right answer, rickets is associated with the deficiency of what vitamin? D. Moving on to our next question. Pellagra is associated with deficiency of which of the following vitamins? Option A, vitamin A. Option B, vitamin B1. Option C, thiamine. And option D, niacin. So the right answer is pellagra is associated with deficiency of option D, that is niacin. Okay friends, moving on to our next question. The major action of angiotensin 2 is option A, increased pituitary secretion of vasopressin. Option B, increased vasoconstriction. Option C, increased parathormone secretion by the parathyroid. Option D, decreased adrenal secretion of aldosterone. So the right answer is option B, because of increased vasoconstriction. Okay friends, moving on to our next question. The urinary excretion product measured as an indicator of epinephrine production is option A, dopamine. Option B, dihydroxyphenylalanine, that is DOPA. Option C, homovanillic acid. And option D, vinyl mandelic acid, that is VMA. So the right answer is option D, that is VMA. Moving on to our next question. Which of the following hormones regulates normal blood calcium levels? Option A, thyroxine. Option B, estradiol. Option C, parathyroid hormone. And option D, growth hormone. So the right answer is option C, parathyroid hormone. Moving on to our next question. A patient has signs and symptoms suggestive of acromegaly. The diagnosis would be confirmed if the patient has which of the following? Option A, an elevated serum phosphate concentration. Option B, a decreased serum growth hormone releasing factor concentration. Option C, no decrease in serum growth hormone concentration 90 minutes after oral glucose administration. And option D, an increased serum somatostatin concentration. So the right answer is option C, no decrease in the serum growth hormone concentration 90 minutes after the oral glucose administration. Moving on to our next question. How is primary hypocortisolism, that is addition disease, differentiated from secondary hypocortisolism of pituitary origin? Option A, so they are asking the difference, how it is differentiated from primary hypocortisolism to secondary hypocortisolism. So option A, adrenal corticotropic hormone ACTH is decreased in primary and elevated in secondary. Option B, adrenal corticotropic hormone, that is ACTH, is elevated in primary and secondary in secondary. Option C, low aldosterone and hypoglycemia present with secondary hypocortisolism. Option D, normal cortisol levels and blood pressure with primary hypocortisolism. So friends, the right answer is option B, ACTH is elevated in primary and decrease in secondary, because primary hypocortisolism is equals to decreased cortisol or elevated ACTH. Okay, ACTH. So the secondary hypocortisolism is equals to decreased cortisol and decreased ACTH. So in secondary both will be decreased. Okay, both cortisol will be also decreased and decrease ACTH. But in primary hypocortisolism, decrease in cortisol and elevated in the ACTH hormone. Okay friends, next moving on to our next question. Detection of which of the following substances is most useful to monitor the course of a patient with testicular cancer? Option A, alpha fetoprotein. Option B, carcinoembryonic antigen. Option C, prolactin. And option D, testosterone. So the right answer is option A, alpha fetoprotein. Moving on to our next question. Clinical assay for tumor markers are most important for clinical assay for tumor markers. Option A, screening for the presence of cancer. Option B, monitoring the course of a known cancer. Option C, confirming the absence of disease. And option D, identifying patient as risk for cancer. So clinical assay for tumor markers, they are most important for what? So the right answer is option B, they are important for monitoring the course of a known cancer. Okay, moving on to our next question. Carcinoembryonic antigen, that is CEA, is most likely to be produced in a malignancy involving what? Option A, brain. Option B, testis. Option C, bone. And option D, colon. So the right answer is option D, colon. CEA, that is carcinoembryonic antigen. It is likely to be produced by a malignancy. It's a kind of cancer causing colon cancer. Okay, moving to our next question. Cancer antigen 125, that is CA125, is a tumor marker associated with option A, breast carcinoma. Option B, colon cancer. Option C, lung cancer. And option D, ovarian and endometrial carcinoma. So the right answer is that is CA125 is a kind of tumor markers, that is a kind of cancer which is associated with option D, ovarian and endometrial carcinoma, which can be mostly seen in the female patients. Okay friends, moving to our next question. Aldosterone is released by the adrenal cortex upon stimulation by option A, renin. Option B, angiotensinogen. Option C, angiotensin 1. And option D, angiotensin 2. So aldosterone is released by adrenal cortex upon stimulation by what? Option D, angiotensin is the right answer. Next, moving on to our next question. Increased concentration of alpha fetoprotein, that is AFP, in adults are most characteristically associated with elevation in the AFP is mostly characteristically associated with which type of cancer they are asking. Option A, hepatocellular carcinoma, that is hepatocellular cancer. Option B, alcoholic cirrhosis. Option C, chronic active hepatitis. And option D, multiple myeloma. So the right answer is option A, that is hepatocellular carcinoma. Okay friends, moving on to our next question. Plasma for cortisol determination were collected at 7 a.m. after waking the patient and 10 a.m. that evening. The cortisol level of the morning sample was higher than the evening sample. This is consistent with option A normal finding. Option B, Cushing syndrome. Option C, addition disease. And option D, hypopituitarism. So the right answer is option A. It is a normal finding. So friends, as you all know that the normal variation for the serum cortisol is higher. Always the serum cortisol will be higher at morning times, that is at the 8 a.m. that is morning times, than the evening time. So higher in the morning and lower in the evening. It is a kind, if you go through this case study, then we are finding that it is a normal finding. So friends, these are your part biochemistry MCQs practice questions. So hope you are liking it. Please do like, share and subscribe to my channel. Keep supporting me. See you soon in my next video. Thank you.